Hey everyone, my name is Chinmay, and today I'm going to tell you all a little bit about the Financial Alignment Initiative, which was a series of demonstrations by the Centers for Medicare and Medicaid Services aimed at improving care coordination for duals, or individuals that qualify for care under both the Medicare and Medicaid programs. But before I talk about financial alignment, I wanted to give a quick refresher on Medicare and Medicaid. So Medicare is a federally funded program that covers individuals above the age of 65 and some younger individuals with disabilities. Medicaid is funded jointly by the federal government and state programs and offers healthcare coverage to lower income Americans and some disability groups. So now to give a little bit of context on the primary policy challenge the Financial Alignment Initiative sought to address. So for the over 12 million duals across the country, Medicare will cover physician visits, hospital stays, post-acute skilled care, and prescription drugs. Medicaid will provide financial assistance with Medicare costs and will cover some services that Medicare doesn't, like long-term services and supports. So duals receive different services from these two entities that do not have much coordination in administrative procedures and financial incentives. And as a result, they often receive poor care and receive duplicative or fragmented services. So beyond this, duals also often have very complex and long-term health needs. And this, paired with the fact that they receive poor care, leads them to account for a disproportionate amount of spending in both the Medicare and Medicaid programs. So the Financial Alignment Initiative sought to address this policy challenge by improving care coordination between Medicare and Medicaid. And it did this by testing two new payment models that would better integrate the financial flows between Medicare and Medicaid and various administrative integration initiatives. Financial Alignment Initiative is different than other integration efforts before it because it's much more comprehensive. So the first model tested by Financial Alignment Initiative was the capitated payment model. And under this model, plans would receive capitated payments to manage both the Medicare and Medicaid services for their duals. The second model was managed fee-for-service. And under this model, providers would receive payments under existing fee-for-service systems, but states were then eligible to share savings that resulted from demonstration-related initiatives. As far as administrative alignment, states typically integrated enrollment processes, contract management, marketing materials, care planning, quality assessments, and appeals processes between the Medicare and Medicaid programs. And financial alignment demonstrations covered Medicare Parts A, B, and D services and all Medicaid services. So these programs were for full benefit duals. So here on this map, you can see which states participated in financial alignment. The ones in dark blue use the capitated model, and the states filled in light blue use the managed fee-for-service model. So looking at academic reports and evaluation reports, we see that the financial alignment demonstrations had mixed impacts on just about everything. So financial alignment demonstrations did not typically impact spending, and in some cases actually increased spending for Medicare Parts A and B. Demonstrations also saw mixed impacts for service utilization, both within and between states. So what this means is that some states found unfavorable outcomes on utilization indicators, but favorable outcomes for others. And then states varied on just which service utilization measures their demonstrations had a positive impact on, a negative impact on, or no impact on. This trend of mixed performance continues for quality of care indicators. So in some states, a majority of demonstrations received full quality withhold payments, and in others, plans varied in how much payment they received. Demonstrations also varied significantly on HEDIS measurement performance, which is basically a benchmark for quality of care. So some demonstration plans performed better than Medicare Advantage benchmarks on some measures, but worse on others. Beneficiary satisfaction with respect to care coordination also varied between states. So in some programs, beneficiaries reported a high level of satisfaction with their care coordination, and in other states, beneficiaries reported inadequate or poor care coordination. So before we talk about kind of broad takeaways from the Financial Alignment Initiative, it's important to recognize that limitations in data hindered us from seeing a full picture of what exactly the Financial Alignment Initiative did. So many states could not offer complete insights on service utilization trends due to lower than expected enrollment in their demonstrations or insufficient encounter data. Additionally, cost savings were based only on Medicare Parts A and B spending and didn't account for Medicare Part D or Medicaid spending. But keeping all this in mind, the Financial Alignment Initiative might have surprised policymakers for how robust its model was. The demonstrations typically saw few generalizable trends across demonstrations and experienced mixed results across states with respect to cost saving, service utilization, quality of care, and beneficiary experience. And it's primarily for this reason that financial alignment designs will not become the standard practice of care for duals. In some states, though, like California and Massachusetts, agencies are planning to incorporate successful elements from their FAI demonstrations into future models of care for their duals. So thank you all so much for listening. If you would like to read my full report on the Financial Alignment Initiative or have any questions about my talk, you can reach out to me or my wonderful faculty mentor, Dr. Kate Bundorf, at the information below.